Okay. It seems that it's waking up. Keep the breathing. Check the stat, please. Oh, hello there. Don't worry, you are in great hands. We found you unconscious. You are whispering hospital. How are you feeling? Can you breathe? Okay, let's try, okay? Okay, can breathe on its own. Perfect, thank you. Just check for a room upstairs, okay? Hi, I'm Dr. Whispers. How are you feeling? Okay, very good. So we're gonna take you upstairs. We're gonna do some examinations. We're gonna start with a cranial nerve exam, okay? But right now you're down here in the emergency room. This is where they brought you. Okay. Do you know what is 1 plus 1? Okay, good. Do you know your name? Okay. Nurse? You have something around this area that I need to remove, okay? Nurse? Thank you. Don't worry. Okay. What is it? Like needles. Do you remember anything? No? Yeah, someone brought you, but they didn't give us any information about you. Don't remember. It's okay. At least you are now stable, which is the important thing. Is there anything that you can remember? Your age? Date of birth? Do you know who is the current president? Can you describe what are you wearing right now? Can't recall. Okay. This question says it's gonna allow me to assess how is your brain, okay? It seems that you had a concussion too. There is a laceration in the back of your head. Maybe you had a fall. Maybe there was a car accident, but there are no reports about that. But you're stable now. Don't worry. I know that you're scared and that you cannot recall many things, but sometimes it's just a shock. We are just getting ready to move you upstairs so you can be more comfortable. Nurse, how is that room coming? We're gonna go to the exam room too. Yes, it's critical for the cranial nerve exam first. Okay. I'm sorry that we have you like this. We are packed today. I don't know what's going on, but I'm gonna check you a little bit here, okay? There's gonna be a really bright light right now, okay? Good response. Do you feel dizziness? Okay. Okay, I need you to tell me what figure I'm doing with the light, okay? A circle. Very good. Yes, can you assess that? Thank you. Let's go with the next one. Very good. A square. Okay, can you look straight forward to me? Don't blink, okay? Good. Thank you. Yes, nurse. That seems fine. But still, please call Dr. Whispers. Yes? Neuro? Yeah, it's gonna be necessary. Thank you. How is your breathing? Okay. Can you breathe properly? Okay. I'm gonna do a little test. I want you to hold your breathing for 5 seconds, okay? Breathe in and hold for 5, 4, 3, 2, 1. Good. Very good. Lungs seem fine. No issues there. Have you checked the whole body? No laceration? Only in the back. Okay. Sadly, we don't have any clue what is going on with you, on what happened actually. The person that brought you here said that they found you in the street, and that's it. They didn't say anything else. Okay. Very good. I'm gonna touch your face. Let me know if you can feel it. Good. 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 Your response time is a little bit odd. Can you hear me well? Nurse, prepare also ear exam. There might be some issues there. Since we cannot help you move right now, we don't know if your balance is correct. We don't know if there are some issues in your ears, so we're gonna check you with our specialist for that, okay? How is the heart? Fine? Okay. The other vitals? Also looking good? Thank you. Very good. We're almost there, okay? Just a couple of minutes and you're going up. We're gonna go first with the most important thing, which is the cranial nerve exam, okay? You're feeling more calm? Yeah, you don't seem that scared anymore. I'm happy for that. More calm. I think you can actually sit now. Yeah. Okay, move one arm. The other arm. Okay, one leg. Move the other one. That looks great. Okay, but we're gonna move you with a wheelchair, okay? Just to make sure you're gonna be seated during the most of the examinations, but you need to be in that position, okay? How is the room? Getting clear? And the specialist? Thank you. Other than feeling that you can't remember things, is there anything else that you can tell me? Okay. Oh, well, for the clues that I have here, maybe were you practicing some sport? I'm saying because of the way you're dressed. It's definitely a sportswear. Yeah, it was near a park. Yeah, near the hiking area. You recall that? Do you recall if you were alone? Okay. Oh, I'm so sorry. Are you fine? Okay. Nurse, it's ready? Thank you. Okay, we're gonna send this to the doctor for the full examination, cranial nerve exam, and also ear examination with otoscope, if it's possible. Thank you. Well, you're moving up, so they're gonna take good care of you with examinations, and I hope that you feel better. Okay, take care. Nurse, all yours. I just need you to relax a little bit. You can take and close your eyes while we move you, okay? Yes. Okay, we're here for your health insurance medical checkup. Okay, very good. Okay, I see here that they are requested very specific examinations. Okay, from your eyes, ears, breathing, and your face. Okay. Very good. So, are you ready? We're going to start by checking your vitals. How are you feeling today? Well, I mean more of physically. How are you feeling? Do you feel tired? Do you feel sad, angry, with energy? Okay. What is your line of work? Do you experience a lot of stress in your work? Okay, I see. Is there anything that you believe is your major stressor? Could be work, family, friends, hobbies, depth. Okay. Don't worry, you don't have to explain to me anything in detail. I just want to know overall. Okay. That's okay. Thank you. Let's check that heart. Okay, I'm gonna be very close to you for this. I'm gonna go inside your shirt for palpating this. Okay, it's gonna be a little bit cold. Let me warm it up a little bit for you. Okay, here we go. Ready? Okay. Very good. Can you tell me about your stress? Okay, I just want to hear how your heartbeat changes. That's okay, thank you. That's enough. Okay, good. Now I'm going to your back. Can you cough for me? Okay, good. Now I need you to breathe in very deep. Very, very deep. Excellent. In and out. In and out. Very good. That is enough, thank you. Okay. Now, let's check your blood pressure. I see your arm. That one's okay. I need to see your arm here. Okay, good. Are you ready? Good. Excellent. Thank you. Let's see. Your vitals were normal, so that is great. Oh yeah, it was a gift from my son. Pretty cute, isn't it? Very good. So vitals are great. Need to write this down for your medical insurance. Now let's check those beautiful eyes. Okay, they want a detailed exam from your eyes. So let's check them out. Okay. Okay, try not to blink. Good. Doing great. Okay, that looks good. Okay, perfect. See your other eye. Try not to blink, please. Good. Very good. Okay, excellent. Doing great. And we're done. Okay, good reaction, pupil reaction. There are no discoloration, no broken blood vessels. Good reaction there. Have you ever had any procedure in your eyes? LASIK operation? No? Okay. Now looking straight forward to me, I need you to focus on my nose or my lips, which are red. Okay? Now, don't move at all. Just want to see how your eyes react to the light. Good. 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 Excellent. Now again, looking straight forward without moving your head or your neck, only your eyes. Follow the light. Good. Good. Okay, I know what it's going to be easier. Follow my finger. Good. Very good. Excellent. Now cover one eye like this. Follow it with your eye. Good. Good. Now cover your other eye, please. Good. Good. Excellent. Okay, I'm going to be covering your eye too. That looks good. Excellent. Excellent. That looks great. Now, can you open your mouth, please? Good. Okay. Excellent. Everything looks good right there. No problems whatsoever. Okay. Let's check your breathing. Have you had any colds recently? Sore throat? Flu? Nothing like that? Not recently? No? Okay. I want you to breathe in through this device right here. Okay? You ready? Breathe in. Breathe out. Good. Let me just adjust it a little bit. Again. Breathe in. Okay, I'm adjusting once again. You're doing great. Okay, good. Now I'm gonna put you a monitor in your wrist. This is gonna measure how you're breathing. Okay, can you see your right wrist? Okay, good. Excellent. Now we're gonna be doing a couple of breathing exercises. Okay, I want you to hold your breathing as long as you can, okay? Breathe in and hold it, okay? Gonna be reading the wrist monitor. Don't worry, as much as you can, but don't overdo it, okay? Until it's comfortable for you. Okay, good, very good. Now breathe easily like you normally do. Try to catch your breath. Okay, I'm still checking the monitor. Okay. Now I want you to do it again. Deep breath in and hold it. Okay. Release whenever you want. Okay, whenever you feel it's enough. Okay, good. Okay, I'm just observing how you're recovering from it. Okay, good. Very good. Thank you. Now you can rest for a little bit. Now my next examination will be of your face. We're going to leave your ears to the last, okay? Now they want to make sure that there is no signs of malign moles or beauty marks, freckles. So we're going to be checking your whole face for it and your neck area. Okay? Very good. For this I'm going to be very close to you and I will be touching your face. Is that okay with you? Okay, good. Yeah, I noticed that you're wearing a little bit of makeup, so we need to remove that in order to do your face examination. Do you have any skin allergies? No? None? Okay. Don't worry, even if you had, we have our makeup removal that is perfect for any skin type. Yeah, sometimes they fail to notify the patients that they don't have to wear any makeup during these checkups. So, yeah, it's very important to come with a clean face. Good. It's a little bit tough on here. Waterproof. Oh, it's removed with micellar water. Okay, so you just need to be a little bit deeper with the removal. I will be using a magnifying glass to examine your skin. Okay. My light is here. Start in your forehead area. Okay, right now it's a stereo examination. Okay. Very good. I need to be a little bit closer for this. We're gonna start on this area right here. Sometimes there are moles or skin tags that have to be removed because it could be a risk for our skin health. And that is what I'm gonna determine today. We have a few here that could be a risk. No, we don't deal with this kind of things. We just do a checkup for the insurance company. Normally they can refer you to a dermatologist for further checkup and extraction. And I'm gonna put a note into your review here, okay? Yeah, you definitely have to be canalized to a dermatologist as soon as possible. Yeah, I see a few skin tags and moles that could be at risk. That would like to be checked up and have a biopsy of them. I'm gonna put it actually as an urgent matter. Could be done this week, by the end of the week. Okay, this one too. This area specific. Okay, I'm gonna be checking your neck area too here. I know it tingles a little bit, I'm sorry. Okay, this area too. Be a problematic area. Yeah, we actually have a great dermatologist that I believe he's gonna be where they're gonna send you the referral. area 2 in particular could be troublesome, and here too. Gonna put a note in this particular section along with this one here. Okay, let me just write this down. Now I'm gonna put this as an urgent matter. I believe you're gonna receive the call today, and they're gonna refer you to the dermatologist to have an appointment by Friday. So actually, the moment that I finish here with you, I'm gonna put the order there. So they're gonna call you pretty fast, I believe. Okay, now the only thing left is your ear checkup. I left it for the last part of your checkup because I see in your medical history that you had a few issues with your ears in the past. Okay, we're going to start with hearing examination. Okay, I'm going to be using this tool right here. It's going to create a sound. I want you to let me know the moment that you can hear it. Okay? Okay. Yeah, the moment that you can perceive the sound. Okay. Good. Very good, thank you. Now I'm gonna whisper a series of words into your ears, and I want you to repeat them to me, okay? Don't worry, they're pretty easy. Red. House. Blue. Good. Blue. House. Blue. Red. Excellent, thank you. Now I'm gonna be checking your ears directly. This is a very delicate area, so I want you to stay still, please. Don't move, try not to talk. We'll be silent during this examination checkup. Okay? I will be inserting this tool into your ears. It's called an otoscope, so I can check them thoroughly. Okay? Please try not to move while I'm doing this. It's a very delicate area. Okay? Gonna be side to side, so I can check your ears. Are you ready? Okay. Very, very good. Excellent. I did a very thorough examination of your ears. That's why it took me quite a while to finish it. Luckily, I didn't find any blockage. It's completely clear. It looks very nice. But with your medical history with your ears, it was important to be very thorough with the examination. And there was a little bit of earwax production. I see that you have trouble with that. That is very high in your case. You have had quite a few visits with specialists, and I see here that they had performed quite a lot of extractions on you. Yeah. Okay, yeah, that's why your health insurance want to know what is your current status with your ears. Yeah, you could use an ear cleaning, but wouldn't worry about that right now. At the moment, what I want to do is just refer you to a dermatologist so we can clear your face from moles and skin tags. Is what is most important at the moment, and your ears can wait a little bit. Okay. Now we're just gonna do your balance checkup. Can you stand up for me, please? Okay, now stand up in just 1 foot. Okay, now in the other one. Okay, now both feet. Close your eyes and place your finger in your nose. 1, 2, 1, 2. Continue doing that. Okay. Do you feel dizzy? Not at all? Okay. Do you feel any pain? No? Okay. Open your eyes and continue doing that. Any problems with balance, dizziness? Okay. Can you walk to the back a little bit? Now forward. Stay there. Good. Very good. So, excellent. Now I'm going to be sending this information to your health insurance and do the appointment for your dermatologist. As I was saying, they should be calling you in no time, probably for this Friday. Do you have any questions? Well, just wait for your health insurance call, and that will be all for me today. Any questions, and you can call us or call directly your health insurance. It was a pleasure. Take care. Goodbye. Yeah, I can see the next patient, please. Thank you. Welcome to your cranial nerve exam. Can you tell me your name, please? Let's see here. Your information. You had a concussion, correct? Okay. When did this happen? So recently, isn't it? How are you feeling at the moment? You don't seem confused. Do you know what's the Pope's favorite cake? You don't know. Okay, interesting. Do you remember what was the last thing you ate 3 years ago? Not quite. You don't remember. Okay. Well, interesting. You don't remember what you were doing 2 years ago. No, you should remember. I do remember. Now, please tell me, at the moment, do you feel anything odd? Maybe, are you seeing butterflies flying? Do you have a headache? Mild headache? Mild headache. So, what we are going to be performing today is a cranial nerve exam, a complete examination of your nerves. And also, we're going to be checking your scalp for any bumps and bruises that you may have. Okay. Now, please sit comfortably while I check your scalp. Yeah, like that is okay. Can you do your hair to the back? Just like that. Let me just prep up your muscles. So the headache that you're feeling at the moment, let's say in a scale of 1 to 1,000. 1,000 being the worst pain you have ever felt, and 0 being no pain at all. How are you feeling right now? I see. So, I'm going to take a look to your scalp. Do you feel any discomfort in this area? How about here? Okay. And here? How about here? So, 100. Yeah, I do feel a bump in this area. Do you remember how you got the bump? Was it an accident? A hit? Somebody did a boink into your head? You don't remember. Well, that could be a symptom of the concussion. You're having trouble with your ears. Can barely hear. How about your eyes? Not quite. That's interesting. So you're telling me that you have trouble with your ears and your eyes. Okay. So I'm gonna be bringing my tools so we can do your cranial nerve exam. I'm a bit worried about your ears and your eyes, so we are gonna be taking a close look into those areas, okay? There you go. One moment, please sit. Okay. Now I just want you to relax. Sit back. And let's start by checking your eyes. I want you to look straight forward while we're going to be doing this examination, okay? I'm going to be using this for the moment. Okay. looking straight forward. Like that is okay. Good. Good pupil reaction. Let's see the other eye. Ooh, okay. There's some broken blood vessels here. Very well. I want you to look straight forward, like that. You're not going to move your head or your eyes, anything, okay? Good. Okay. Now focus on my nose. You're going to follow the light just with your eyes. Good. Good. Just with your eyes. Not quite. Let me lower the lights. One moment. We're going to be trying again. Focus on the light. Good. Good. Interesting. Your pupil reaction is good once I'm doing it close to you, but then it diminishes. Let me just turn on the lights. Okay. So let's do a test. You're going to be focusing here. Ready? And you're going to tell me how many feathers are here. How about here? Can you tell me what color is this? Barely. Just one moment. Okay, let's try again. Can you tell me what color is this one? And this one right here. How many feathers are here? As many as you can count. I see. Can you tell me what color is this one? Just right here. You can tell. Okay. We're gonna check a little bit further using a different tool. Okay, I'm gonna be close to you. Interesting. The reaction is good. The movements are also good, but there is something that is missing. Okay. I want to be a little bit closer, okay? There we go. Okay. Thank you. You can rest your eyes. Now, just gonna check how your sense nerves are working. I'm gonna be touching your face with several objects, and you're gonna tell me the moment that you feel them. Yeah, the exact moment that you feel them. Okay? Good. Just like that is okay. I'm gonna ask you to please close your eyes. Good. You ready? Here we go. Good. Can you feel this? Good. Can you feel this? Not quite. Let's try again. Close your eyes. Can you feel this? How about this? And this? Can you feel this? Not quite. Okay, eyes closed. I'm gonna pinch you a little bit. And you feel this. How about here? And here. Do you feel that? No. Okay. We're gonna try again. You're gonna close your eyes. Let me know the moment that you feel this. Yeah, it's wet. You feel that? That's a good reaction. That was what I was aiming for. Now the last test. Hopefully you're gonna be feeling this. Eyes closed. Once again. Good. Let me know where do you feel it, okay? Well, those are the exact places, which is good. That tells us that the nerves are intact, but there is some degree of degradation. Not that much, but something that we have to take into consideration. Okay? Now, let's go with the olfactory nerves here. Are you ready? Eyes closed. Let me know when you can sense the smell of this. Do you know what it is? Not quite sure. Okay, let's try again. Eyes closed. Now, what is this? No? Okay, eyes closed again. What is this? You don't know? Well, this one is pretty easy. It's a camera lens, which is something odd that you cannot perceive the aroma. Odd. Maybe you can perceive this one here. Eyes closed again, please. Are you ready? Can you perceive this? Vanilla. Correct. That was the aroma. Good job. So your olfactory nerves are completely intact, which is great. I'm still worried about your eyes and your ears, which we're gonna be leaving. We're gonna do that now. Okay. Let's check those ears. Okay. Get my otoscope here. Very well. Okay, I'm gonna be very close to you so I can check your ears. Okay. Well, this is new. A lot of earwax. Quite a lot. Let's try here again. The same. A lot of earwax. Luckily it's not impacted, which is gonna be easy to remove. and we're gonna have to perform a cleanup. Okay? Now, I'm gonna be whispering a few words into your ears. I want you to repeat them for me. Okay? No? Nothing? That means... Let's check the other ear. Nothing at all. Okay, so I'm gonna need you to stand up for me. Now I want you to dance that TikTok dance that goes like this. I think it's called floss. Just do it as you can. Okay. Now I want you to perform 5 burpees. Yeah, complete, please. Okay. I need to take notes. Okay, continue. Just 2 more. Very good, thank you. You can take a seat now. I know it can be tiring. Interesting. So I believe that the reason that you cannot perform the TikTok dance is because of the earwax present in your ears. So I'm gonna perform an ear cleaning. Let me just get my tools here. Okay, this will do it, and this one too. Now, for your ear cleaning, I'm gonna ask you not to move. Please stay very still because I will be using my ear cleaning tools into it, and it could be dangerous if you move. Okay? Very well. Please don't move. Okay. I was able to remove everything from your ears, so now they are absolutely spotless. Let's try again to check the ears, okay? I know it's quite relaxing and a lot of my patients fall asleep, but it's very important to stay awake. Okay, let's check those ears. Good. Looks absolutely perfect. Let's check the other one. Nice. Very good. Okay, I don't need my otoscope anymore. Let's try your sense of taste. I'm gonna ask to open your mouth. Okay, that looks good. Good. Let's see what I can give you to taste. I know. This should work. I'm gonna ask you to close your eyes and let me know what you are tasting. These are very easy to learn, okay? Open wide. Good. You don't know what it is. Well, it's the taste of green, of course. That's odd. Let's try again. Okay, open again. Eyes closed. Do you know what is this taste? It's a toothbrush, of course. That's the easiest one. There could be a problem in your mouth nerves. I have to dig deeper. Okay, open your mouth. That should do it. Like that. Okay, good. Let's try again. Okay, open your mouth. Good. Vanilla. Very well. Well, that worked great. Let me just write that down before we forget. Let's check here. So your olfactory nerve was working good. Your optic nerve, not the best, but it worked. Glomotor, good. Trochlear, your eye movements, medial, it was satisfactory. Your facial nerves will working good. Gag reflexes, good. Taste too. Okay, I'm gonna ask you to smile for me. Big, beautiful smile. Now front, like you are angry. Now a very, very, very sad face, like, I don't know, you lost a candy. Okay, good. Okay, you were able to identify the scent. Visual acuity, that's good. Smile, show me your teeth, big green. Good. You were able to hear my whispering, and well, I believe that we found that your nerves are almost Good. There's something that's missing out, but we're gonna fix it in a little bit. Don't you worry about that. And I have the perfect tool for that. This fixes everything. It's a magical tool. Works perfect on nerves. Makes them work perfectly. There we go. And we're gonna put you in the babe chamber. You're gonna start smelling some good aromas coming your way. Mostly chamomile. And it's gonna feel a little bit warm, but that's okay. Okay, let's stay there for around 5 minutes. Okay, I'll be back in a moment. I would recommend you to close your eyes. How was that? Quite relaxing, isn't it? I know. I'm just the best. So, let me just send the information that you are completely cured. No more nerve damage. And let's check it out here. Good. Let's put it here. And there we go. And what was the other one? Yeah. Good. 23. Well, I believe that you are good to go. If you have any questions, maybe. We like a lollipop. I have one right here that is completely delicious. Candy cane. Quite good. And minty. No? And a final candy? Okay, very well. So in case that you need anything else, please call us, or if you feel bad, that I don't really think you will feel bad, please call us or contact us. Okay? Now it's time for my nap. So take care. Goodbye. Hello there.
uses contact lenses to read or drive or any of those activities. To use a computer. Okay, those are just to protect your eyes for. Very good. That's a very good choice. Very well. So let's check your eyes. Let's see the other one. Good. Now we're gonna look straight forward, please. Now let me know the moment that you can see the light without moving your neck or your head. Okay? Good. 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 Now you're gonna follow the light only with your eyes without moving your head or neck, okay? Good. Good. Very well, thank you. Let's check those lungs, okay? Now in the back, might be a little bit cold, okay? Can you cover me? Good. Again. Now deep breath in. Good. Now let's cough again. That sounds good. Very good. Now let's check your heart, okay? It's gonna be cold. Good. Very good, thank you. Yeah, sometimes it's a bit too cold. Okay. Now let's check off is your pulse and your blood. I'm gonna place this in your wrist. It's gonna be a little bit tight while I'm doing it. Okay. If it's too tight, you feel that it's uncomfortable, let me know. It shouldn't hurt, okay? Very well. Also, you shouldn't be feeling any dizziness. Doing good. Okay, good heart rate. Quite great. Excellent. Now, I'm gonna be inspecting your nostrils, okay? I'm gonna be using this. Now I'm gonna ask you to look up for me. So now I'm gonna be checking your nostrils. I'm gonna ask you to look up for me. Okay, ready? Looking up. I'm sorry, it's too bright. Okay. Good coloration. Okay, that's great. Thank you. Let's check your mouth, okay? up and wide. Keep it like that. Good. Good. Okay, good. That looks great. Thank you. I'm gonna be pressing these areas of your sinus. Let me know if you feel any discomfort or pain, especially if you feel too much pressure, okay? How does it feel? No discomfort, pain. Okay, I'm gonna push, 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 push. No discomfort. Okay, now we're gonna look up. Gonna feel this area of your lymph nodes. Might tickle a little bit. Yeah, this part is a little bit difficult to my patients. Tend to be very ticklish. Okay, now I'm gonna move your neck a bit. Any pain when I do that? None. Okay. Very good. I can see here in your medical history that you have quite extensive examinations of your ears with an issue with earwax overproduction. It does say that they have tried various types of treatments on you, and the improvement hasn't been that well. And I know that your employer is aware of this issue. Yeah. Okay. Before we continue, I want to inspect your ears first. I'm leaving it at the end because I know that it's a big issue with you. Now, how have you been feeling since the last examination of your ears? In terms of feeling dizzy or losing your hearing, anything like that? No difference whatsoever. Okay. Let's do a little hearing test. I'm gonna be using this tuning fork. Okay. You can hear it, but a kind of far away. Okay. So let's check out the area. Yes, definitely. It's clogged quite a lot. It's consistent with what it says in your medical history, that it's clogged mostly in the entrance, and then it's quite hard. Let's see. Let me know if you feel discomfort, pain, or soreness of any kind, okay? No matter if it's small, just let me know, okay? Good. How about this? Okay. And here. Very good. Well, it is clogged and quite a bit full, but issue is big on you. So right now you're in time. You have your appointment for the ear cleaning, and it's gonna be this week, right? So there are no problems there. So we can continue with the examination and your medical exam here. Now I'm gonna ask you to close your eyes. I'm gonna be touching your face in several parts. Let me know the moment that you can feel the object that I'm gonna be touching you with. Okay? Very good. Eyes closed. Forehead area. Middle forehead area. Your chin. Nose. Okay. Your cheek. Good. Very good. Keep your eyes closed. Now I'm gonna be touching you with different kind of objects. Let me know if what I'm touching you with is a soft or hard. Okay? Let's go. Okay, hard. Just a moment. Okay, let's go again. Ready? Eyes closed. Soft. Hard. Soft. Hard. Soft. Hard. Soft. Hard. Okay, good. Now, this next test is a bit tricky. I want to know if you can feel the temperatures, the difference of temperature, okay? I'm gonna touch you with a little bit of cold objects, and other objects are gonna be warmth, okay? We're gonna keep our eyes closed again. Ready? Warm. Cold. Warm. Cold. Warm. Cold. Warm. Cold. Excellent. Thank you so much. Now I'm just gonna ask you to stand up for me. Okay? We're gonna do a series of exercise. I want you to rise. Raise your knee, the left one first, and stay in that position. Okay, we're gonna do the same with the other knee. Good. Now we're gonna alternate up and down, without jumping, just going up and down. Okay, good. You can take a seat. Now we're gonna raise your hands like this in this position. I'm gonna be checking your elbows and your knees. Okay? Gonna be present with this in that position. Good. 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 Now the other one in that position. Good. 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 Thank you. You can lower them. Now with your knees in that position. Okay? We're gonna cross one leg. Like that. Thank you. Good. Once again. Very good. Now we're gonna cross the other leg. Very good. Ready? Good. Once again. Very good. Once. Excellent. Thank you. You can rest. Okay, so I'm happy to inform that your medical exam went well. Besides your ears, you are in excellent shape, and your health seems pretty good. I don't see anything that could disrupt the information for your potential employer. The pleasure. Thank you so much for coming. And don't worry, everything's gonna be taken care of by our side, and you're just gonna receive on the email with the information that you provided a little copy of what we did today. Okay? If there's anything else I can do for you, it's my pleasure. Please take care, and you can go right here on the side in the reception area. They're gonna give you a note, and that you're gonna scan it with your phone and send you to a link where all your